Tonight, a new study lists the underlying conditions that increase risk for coronavirus patients. The top three: hypertension, obesity, and diabetes. Those are more likely to be found among African Americans, a community where the virus is taking an especially heavy toll. CBS's Jeff Pegues reports tonight from Baltimore.
COVID-19 has left two gaping holes in Sandy Thomas's life.
Mommy and Penny are gone, and it's very sad and lonely in there.
On March 18th, her 87-year-old mother, Gertrude, was admitted to a Baltimore hospital. Just 5 days later, her sister Penny was too. Both died within days of each other in the same intensive care unit. Are you holding it together?
Through the grace of God.
In Maryland, blacks account for 31% of the population, but almost 45% of the coronavirus deaths. In Louisiana, African Americans make up 33% of the population, but 56% of the dead. Cities like New York, Chicago, and Washington, D.C. also show similar disparities. Dr. Selwyn Vickers says historical inequity plays a role.
They are the ones that not only will have limited access to care at times, but also have a high rate of pre-existing conditions.
This week, the NAACP sounded the alarm through Baltimore's streets.
Wash your hands, wear gloves, and use a mask.
The messaging, the public health guidance just simply was not penetrating certain segments of our community.
Now, Thomas's 39-year-old nephew has tested positive too. She is pleading for everyone to take the threat seriously.
My mother and my sister are gone. They were doing everything they were told to do, and yet it still got them.
The CDC is still gathering data on how the coronavirus impacts communities of color. Critics of the agency's response say this lack of data right now is making it harder to respond to this crisis in the nation's neediest communities. Nora.
All right, Jeff, thank you.